Now, from the News Channel 5 network, this is Medical Mondays.
Good evening, everyone. I'm Carrie Sharp. Thank you so much for joining us for Medical Monday. Tonight's topic, a great topic that I think a lot of people can relate to, and you probably have a question or two for our guest doctor tonight. Dr. Brian Tierney, he's a board-certified plastic surgeon here in town. He's here to answer any plastic surgery question you may have, but we have titled tonight's show, The Mommy Makeover, which is getting pretty popular among all plastic surgeons right now. It includes a lot of different procedures that you can choose from. Dr. Tierney, thank you for being with us.
Well, thank you.
The mommy makeover is kind of a marketing term, but I think a lot of moms can relate to it because after pregnancy, after childbirth, there are changes in every aspect of your body, it seems like. What are you hearing from women about things that they want to resculpt, kind of reconstruct after childbirth?
Right. You hear a lot. There's all sorts of different things that happen with childbirth, and the biggest thing is your abdomen. So excess skin, stretch marks, muscle issues with the laxity. Breast-wise, you have breastosis or sagginess of the breast, or loss of the fullness of the superior pole. So there's lots of different things that go into it. And it's just a matter of kind of prioritizing what that patient wants. Sure. And then discussing the surgery and giving her all the details about that.
We're going to walk through this throughout the next hour of what people can have done, what they're asking to have done, what's wise to have done. So if you have a question, go ahead and give us a call. And again, we are kind of calling this the mommy makeover, but if you have a plastic surgery question tonight, Dr. Tierney is the guy to ask. Go ahead and give us a call. 615-737-PLUS is the number. That is 7587. We'll keep that number up there on the bottom of the screen. We'll get those calls lined up. If you have a question, you're wise to call in right now so we can get those calls lined up and get going, because I have a feeling this is going to be a popular show with lots of callers tonight. Knock on wood. I don't want to jinx us. But let's talk about plastic surgery in general. We were talking about this before the show started. It seems like much less of a taboo topic than it used to be, maybe 10 or even 20 years ago.
Sure. It's very popular nowadays. Everyone's talking about it. The websites, places to go online. So there's all sorts of discussions about it, and people go on Facebook. I know some people that will come into my office will have some injectables, some Botox, or whatever it is, and then go online and take a picture. Show a picture and put it out there, and it's not like someone's going to judge them for having that done. So
you're not sneaking off to the doctor in the other city to have this done anymore.
They're not going behind people's back and trying to get into the doctor's office. So it's kind of nice. It's very open.
When you look for a plastic surgeon, when you decide, okay, I'm ready to do something different, I want to change my body, what should you be looking for in a doctor?
Well, someone that you get along with is obviously a big part. Someone that's board certified, that can do the procedures in a hospital setting if necessary. So people that are board certified have hospital privileges, and that means that that hospital has looked at that individual and they are certified to do that in a hospital, so you can have that done very safely. Anesthesia is also very important, that if you're going to be going to sleep for a procedure, you want a place that's going to be safe to have it done. So that's very important. You can look at reviews online, which sometimes you could get a mixed bag with some of that, but there's all sorts of
You're telling me about a website that's really popular these days for patients.
Right.
What's it called?
realself.com.
And what does it show? What does it do?
So it's got all sorts of procedures, anything you want to look up plastic surgery wise, you could put it in there. They'll give you thousands of reviews of that procedure. Look at, all local, like a Nashville, if you want to see some Nashville doctors that perform those procedures and stuff. So it gives you all sorts of information about the procedure, from cost to recovery, and everything. So it's a really nice information gathering tool for sure.
And is this coming from patients about their experiences, or is it more of like, here's what you can expect medically?
It's kind of an interactive thing. So the patient's point of view, they have all the different procedures and their reviews, but also they ask questions, and some surgeons will answer those questions. So you get answers from all over the country about their procedure, or are they a good candidate? They could show pictures. Sometimes if someone has some kind of issue, they say, hey, is this normal swelling? I'm 1 week post-op. What do you think about this? And other doctors will give their opinions on that.
Okay, let's start from the very beginning here. When moms are usually coming into you, Are they nervous? Are they shy about what they want done? Or are they just like, I am here, I'm ready to do this?
You get all sorts.
Yeah?
Yeah, sometimes they're very ready to go. They don't have a whole lot of time, so they finally made that appointment. They're in your office, and they just want, this is what I want gone, this is what I want lifted, and they're just ready to go. Other patients will be a little bit more cautious. They want to look into it, you know, get the pricing, you know, what's involved, downtime, recovery, how they're going to kind of schedule help with the kids while they're recovering, and so it just depends on the home situation and how much help they have when they're going to do it.
Sure. So it's a lot of education up front,
right?
As it should be.
Sure. Yeah, you have to know as much as possible about these procedures and recovery, for sure.
What's your #1 procedure that you perform?
I'd say abdominoplasty.
Really?
Yeah.
And what can you do with abdominoplasty? We're talking about a tummy tuck. Is that more, I guess, the term that people use? You know, the real people use it. I want a tummy tuck. What would that entail? So
it would entail about 2-hour operation, and you usually have a low transverse incision, and as part of that surgery procedure, you'll have the muscle tightened, which will bring in the waist. You have the excess skin removed, and you also usually do some liposuction to contour the sides.
So what kind of scar is that going to leave you with?
So it's a low transverse scar, so it's going to be below like a bikini.
Okay.
And it may come up a little bit on the sides, but it should be very low. And it just depends on the shape, on where that scar is going to be exactly, but it's going to be very low and hidden.
Okay. And is it something that, is there anything that you can do arthroscopically these days, I guess, with tummy tucks, or is it?
Yeah, no, it's because you're removing skin, and when you're removing the skin, you have to
cut it.
Yeah, you have to make that cut. So sometimes you can do a mini tummy tuck, which is a little bit less of a scar, and it's more like a C-section scar, and bringing out or taking out some tissue in that area. But it all depends on how much extra tissue you have, what operation is going to be best.
Tell me about diastasis recti.
Right.
What is that?
So that is when the muscles, the rectus muscles are here in the midline. And when you're pregnant, they basically come to the outside more, and you need to bring those back to the midline. So you could do as many sit-ups as you want, but they're not coming back to the midline unless you actually bring them back with surgery.
Is that the same thing as a tummy tuck, or are we talking about a different operation?
So it's the same, it's part of the same operation.
Okay.
So when you kind of look at, you're removing excess skin, fat, but you're also plicating or bringing those muscles together so they go from outside to inside.
What can people realistically expect after having a tummy tuck? What should they expect to look at? Are they looking at six-pack abs or not?
Not necessarily six-pack. It depends on how much laxity of the skin above the belly button they have. So if you have very thin tissue and you don't have much fatty tissue, yes, you'll have really flat abdomen, six-pack type abdomen. If you're thicker above the belly button, that tissue is going to be pulled down, so that thickness is going to be about the same. You could do things like liposuction to improve that, but it just depends on the anatomy.
Okay. What kind of downtime are we talking about with a tummy tuck?
So I would say 2 weeks in general. 1 to 2 weeks. The procedure has gotten a lot better with pain control. There's some medicine now that you could actually put in to the tissues at the conclusion of the procedure and make it numb for 3 days. It's called Exparil.
Wow.
So it's a great thing, so you can go home without having any pain, which is a huge improvement for that operation.
I imagine, because when you think about anything, any kind of movement, you're talking about your core. So whether you're sitting up in bed or going to turn, that's going to involve your stomach. How long is that sore?
So yeah, it's about 2 weeks that you're going to be pretty sore with that. But with this medication, you're not sore for the first 3 days, so it's not too bad. It's a lot easier recovery nowadays.
Oh, good to know. Okay, I want to walk through each procedure step by step over the next hour. Of course, we are taking your phone calls too. Dr. Tierney is a board-certified plastic surgeon. Go ahead, give us a call, and we'll get you right after this break. 615-737+ is the number to call. Stay with us.